I was making rounds, actually in a patient's room, was listening to them, and I developed this severe chest pain. It literally felt like somebody was stabbing me in the back and pulling a knife down. I couldn't stand up. I went and sat down on the chair, and I told the patient who I was examining, I said, "You need to call the nurse." I could barely breathe. Every time I would breathe, it would hurt. So he calls the nurse comes running in, and she immediately goes to the patient and goes, "What's wrong? What's wrong?" The patient goes, "It's not me, it's him."
Dr. Dienst came to me with an underlying condition called an aortic dissection, which eventually evolved into a full thoracoabdominal aortic aneurysm.
It took out the blood supply to both kidneys, my bowel. It dissected through the vessels going down to my legs.
A TAAA, or an abdominal aortic aneurysm, is an abnormal or pathological dilation or enlargement of a section of the human aorta. These aneurysms can only be treated with surgery. We have been able to offer such patients, like Dr. Dienst, a less invasive manner, such that they can recover and continue to lead a quality of life that would not have been possible prior to availability of such special stents.
I sought Dr. Lee out after I spoke with a number of other physicians, and they said there's only a handful of people probably in the world that can do this, and even fewer in the United States. That's why I went to him. They said he's the best. After his procedures, I was back at work probably in 10 days. Was I scared? Honestly, yeah, I was scared, but I knew I was in the best of hands. Not just Dr. Lee, but the whole group at Boca.